If you are a man and living well of life, then you always have worried about the transmission of unwanted diseases like HIV. HIV is a virus infection that results from a virus, which can be transmitted in many ways in your body. Fortunately, the presence of the virus may be recognized as early as a week or two by a certain set of symptoms. The initial stage of HIV infection is known as the acute stage. Essentially, you'll develop flu-like symptoms about a week after being in contact with a person HIV positive, and the symptoms will last about 1 to 2 weeks depending on the severity of it. HIV may not cause any symptoms for several years once initial symptoms disappear. Many diseases are showing common symptoms, so don't rush to conclusions without getting tested for HIV first, and that is if you think you've been in contact with someone who has HIV. Don't completely ignore symptoms, as ignoring them can cause AIDS and be potentially harmful. Just watch yourself, these symptoms which are being described in this video keenly. Here are some early symptoms of HIV in men after 1 week. Sore throat. In flu-like symptoms, a person with a possible HIV infection can develop a sore throat, which can cause a dry cough and throat pain. A severe, dry cough that can last for weeks to months without being resolved is a typical symptom in very ill HIV patients. A sore throat can be a symptom of an initial HIV infection, but symptoms like these can often only be recognized in the context of other symptoms. If you've engaged in high-risk behavior or you have a chronic sore throat, an HIV test is a good idea. Swollen lymph glands. Usually, healthy lymph nodes aren't visible. Due to the infection, they become swollen and may look like hard bumps the size of beans. There are many lymph nodes around the body, and as the infection develops, more lymph nodes may swell in response. Swollen lymph nodes can occur early in HIV infection, as your body tries to kill the virus by default. The lymph nodes in the armpits, neck, groin, and behind the ear may get bigger. Sometimes, the swelling is very noticeable. Swollen lymph nodes may be tender and hurt when touched. Even if other signs of the acute HIV infection go away in the start, swollen lymph nodes can persist for many weeks or months in some people. Swollen lymph nodes can also be caused by other associated infections and cancers. Any kind of infection from bacteria or viruses, including HIV, can cause swelling of the lymphatic system. Swollen lymph nodes may appear within a few days of HIV contraction. However, it is also possible not to experience any other HIV-related symptoms for up to several years after transmission of the virus in the body. Skin rash. A rash can be an early sign of HIV infection and occurs most of the time. This is the early stage of HIV, which occurs within 1 to 2 weeks of exposure to the virus. The typical HIV rash is often a flat red area on the skin that is covered with small bumps, which can be felt by touch. If a rash is the result of an HIV infection, it will mostly go away as the immune system produces antibodies to the infection. Viruses can stay in the body for several months and years in silent mode. After this, however, if a person is not taking retroviral medications to treat HIV, they may have a higher chance of developing further secondary infections and skin problems. HIV leads to a weakened immune system, and any disease can infect the body easily. Fever. Fever is the first body response to counter the infection found in the body. Body auto-responds towards healing despite knowing the cause and identification of a disease or attacking the pathogens. Our immune system is evolved to treat itself from infections, which we get from the outer world. By increasing the temperature, the body tries to kill the virus. That's why if someone gets HIV, the fever would be the first sign of infection that the body shows. Fever could be the sign of many infections, but you can distinguish it by other accompanying symptoms we have discussed earlier. Headache and fatigue. When you feel pain in your head, it comes from a mix of signals between your brain and nearby nerves. There is no pain receptor in the brain. If you have a migraine, usually it is not a symptom of HIV infection. Inflammatory response of the body causes many changes in the body. You can feel tired and headache without any reason any time in the day. Changes in body and blood chemistry cause the brain to go under a lot of stress and extra load. In response, you may feel tired. Night sweats. Sweat at night are repeating intervals of extensive sweating while you are in bed. Your clothing and bedding can be soaked by sweat. In the start it can be mild, but as the infection grows, these intervals can increase in severity. If your room temperature is normal and you are wearing seasonal clothes, but experience extensive sweating with other related symptoms, you should go for medical help or a lab test immediately. If you have any additional query, please write and comment for answer.